Three things you should consider before cosmetic injectables is firstly, do I need it? You know, am I an appropriate, the second thing is, am I an appropriate patient to be having this? Just because you want it, you need to be assessed by someone who's got experience and knowledge in the area, because just because you want it doesn't necessarily mean that you're the ideal person to have it. For example, you might come in seeking fillers, but what you actually require is anti-wrinkle injections. Or it may be that you require a combination of the two to get the perfect result. It may be that fillers are not sufficient, and it may be that you need to consider, you know, possible other surgical interventions, because fillers can only do too much. The other thing you need to consider is, do I want to continue having these? Because unfortunately the lifespan of these is anything between 3 to 12 months. On average they last 9 months. So you've got to consider that there is ongoing costs and need for further procedures. There's two very good reasons why you'd see a plastic surgeon for fillers. Firstly, these are S4 drugs, they're scheduled drugs, and they cannot be administered by a nurse without a doctor seeing them. So a lot of these clinics run on sort of Skype consultations, whereas if you see a plastic surgeon, the plastic surgeon will examine you, and even if he doesn't administer the particular fillers or anti-wrinkle injections, will make sure that they prescribe them appropriately and that they've actually physically examined you. The second thing is that there's a lot of bad press at the moment with people going blind with, you know, the injections being placed in the wrong place. If you don't know the anatomy, you don't know where the blood vessels are, you will hit them. If you've got a poor technique and you inject into an artery, you can cause blindness or loss of tissue. People have lost, you know, tips of noses, lips. It can happen with anybody, but if recognised, it can be. Most of these can be reversed. But again, that can only happen if the doctor's physically with you whilst you're being administered these fillers. So the advantage of seeing a plastic surgeon is they've got, you know, a lot more experience in the anatomy. They do a lot more shaping of the face with patients' own fat, for example, or doing a facelift, and they know the anatomy better than anybody, so that they know firstly which spots to avoid, but they'll also recognise a problem if it occurs. Fillers and anti-wrinkle injections can be used to prevent ageing. It's certainly been shown. The key thing is when you examine someone is, are the wrinkles static or dynamic? And what we mean by that is static is where they're at rest. If you've already got wrinkles at rest, you're going to need some sort of filler. If the wrinkles only appear when you animate, when you smile, when you screw up your eyes, when you raise your eyebrows, etc., they're dynamic. And in those situations, anti-wrinkle injections, using botulinum toxin, for example, are the ones that will not only prevent the dynamic becoming static, but will also decelerate your aging as well. So they do have preventative, they can't reverse aging, but they can certainly slow the progression of aging in certain areas.